What I love about special needs dental associates is Dr. Lekavich.
You have to love what you do if you're gonna deal with my daughters, and if you don't love what you're doing, I don't feel comfortable with just letting anyone work on their mouth. I love Dr. Lekavich. He's awesome.
He's patient with our individuals, kind, informative, and obviously very knowledgeable.
Dr. Lekavich has a true gift. With each client, he treats them as individuals, and each patient gets their special time with him, and it's really remarkable to see.
We learned from many people that these patients generally weren't treated, and that together we could find ways for them to be treated no matter what their special needs were.
It's very difficult finding dentists that specialize in special needs.
Most dentists, I think, are intimidated because they don't know how to work with people with special needs.
These patients are often forgotten about. Some of these patients have no family, and there's no one looking out for them. So Wendy and Dr. Lekavich, they're looking out for these patients to get a basic need of dental care.
UCLA Santa Monica is awesome. The treatment that our individuals receive there is more, if I can say, tailored.
Staffing is awesome at UCLA. It's the number 3rd hospital in the nation, and when you go inside, you know why. Everybody has a specific duty, and they work together to accomplish these duties. It's incredible.
And what has just been really one of the most rewarding aspects of our practice in the last 15 years is how much our patients are embraced at UCLA Santa Monica. Dr. Chalabi and Jenny Massey at the Santa Monica Surgery Center do everything they can to make sure cases are done.
And I think that everybody works as like a really good team. It's a really good experience not only for the patients to come in and have this other place that they can get their care, but also it's a good experience for our nurses and our staff to take care of a patient population that they may never have experienced taking care of before. We treat it as if this isn't just another patient that's coming through here that needs a surgery, but it's a person that needs help fixing their teeth because we want them to be able to eat.
We're fortunate enough too to work with entities like the Achievable Foundation in relation to primary care and coordinate some of those obstacles so that patient can get as full of a life as possible, like we all want.
Wendy works hand in hand with Achievable, and we're able to get everything done, and there's no paperwork involved actually.
I think the patients, because they really appreciate what we do for them, they become more educated. And the more educated they get, I've seen less decay, I've seen less periodontal disease, and it's just no one took the time, effort, and energy to explain to them the simple things that they can do to help their own oral hygiene. And that has been incredible.
It's acknowledging that that's a person in front of you who may be in pain, who can't verbalize, who's scared. And you have to have that ability to be able to get in there and get in their world. There's no other way to do it and be successful.
There have been patients that we've treated in the hospital because of behavioral issues. And then once we remove all their causes of pain and their gums don't bleed anymore, we can see them in our dental office.
I like the fact that you guys are here and doing this because it's such an important need in our community. And people forget sometimes that good dental health is the beginning of good overall health.
I think I am most grateful for the smiles I see walking in and out of special needs dental associates. Wendy Lekavich and Tim Lekavich, they have huge hearts and have opened up their practice to this very special community. And it makes it very heartwarming for me and a great part of my day to be a part of it.
Because we need more Dr. Tims who specialize in the dental care and needs of people with disabilities.
That is our ultimate goal. We want to be able to teach people to do what we do.
And our goal within the next 5 years, and we're just actually so excited to be starting now, is to be able to teach students, dental school students and allied dental students, best practices on how to work with our patients and give them exposure and allow them to work with Tim in our office to really get a great flavor of all the wonderful things that it does have to offer. The unknown is always daunting, but once there's a comfort level, really, our goal is that every dentist has at least 10% of their practice with any kind of patient with a disability, because if they do, they're lucky, in my opinion.
This patient population has been in a need for this for so long, and it makes me feel like I'm the luckiest man in the world.
It's just really unbelievable, to have people be able to come here and have a place to be and to be respected and to be taken care of in the best way possible.
You guys are like angels. I just think you guys are angels on earth to come in and do what you guys do, helping this patient population. We just love it. And we love you guys.